Okay, first disorder that we're going to talk about that can lead to or can cause cognitive disability is Down syndrome. Down syndrome is a chromosomal abnormality. It is usually 95% is trisomy 21. Mosaicism is when someone has some normal and some abnormal chromosomes, so they will usually have decreased manifestation. The major risk factor that we're aware of is maternal age. So this is diagnosed with chromosome testing. Prenatal diagnosis is possible, but it is suspected based on some characteristic physical manifestations. And on page 1090 of your book, there's a box 37.3 that has those. There are some physical anomalies that are, or issues that are sometimes associated with Down syndrome. That doesn't mean that every child will have all of these, but these are more common and they have to have evaluation for them. It's frequently associated, or it can be associated with congenital heart defects. They tend to have frequent respiratory infections. They tend to have decreased muscle tone. They're more prone to thyroid dysfunction. There's an increased incidence of leukemia. Hearing loss is not uncommon, and atlantoaxial instability, which means that they are at greater risk for cervical spine injuries. Those are all more common with Down syndrome, but any individual child is going to have individualized expression. The cognitive disability also varies greatly from one person to another. So an assumption that someone with Down syndrome will never develop past a certain level is inaccurate. Management, this kid is going to have surgery to connect any serious anomalies. They need sight and hearing evaluation earlier. They need periodic thyroid function testing. Before participating in any sports with stress on the head and neck, they need to have imaging to evaluate how stable their spine is. The parents need emotional support, and this can be really challenging because even if they really love and this child is loved and they love the child they have, they still may be grieving the child that they thought they were going to have. They also may be afraid of the challenges and risks that their child will face, and they may be afraid of losing the child if they have serious physical characteristics. We need to teach the family how to meet that child's physical needs. With decreased muscle tone, the child is at greater risk of joint injury, so we need to teach them how to hold the child and support those joints. Though if they have hypotonicity, they will be starting PT pretty early. It's common for kids with Down syndrome to have feeding difficulties, partly because of that decreased muscle tone. And so they may need assistance with transitioning to feeding. Temperature regulation can be challenging sometimes, and kids with Down syndrome are prone to constipation because of decreased muscle tone. We want to refer them to resources like early intervention to get all of those therapies that need. The prognosis, there's a really wide range of cognitive ability. Over life expectancy is increasing, but it is still lower than the general population because of the complications that can happen. Over 80% of kids with Down syndrome will live to age 60. The next one I want to talk about is Fragile X. It is an X-linked dominant disorder with reduced penetrance, meaning that if a child with XX or with two X chromosomes has an X with the Fragile X gene on it, they will have some manifestations. It's diagnosed by DNA testing. Prenatal diagnosis is possible. There are some common physical manifestations: a long face with a prominent jaw and large protruding ears. Large testes are common because this is going to happen primarily in males. There are some behavioral characteristics that are also listed in your book on page 1092. Carrier female, so XX persons who have one gene with the one chromosome for the gene with Fragile X may have some decreased manifestations. This is managed. The behavioral complications are the most problematic typically. These kids may have anywhere from mild to severe cognitive impairment and normal lifespan, but they tend to have, or they're more likely to have anger and violent outbursts and impulse control issues. And so medications may be used to help address that. And they may also have some ADHD difficulties. Okay, in the next section, we'll talk about cerebral palsy.